Hi, everyone. Welcome to a Senior Citizens Forum presented by Benefits for You Too Insurance Services. I'm Janice Wood, and I'm your host for this morning. Today, we are going to talk about Medicare insurance. A little bit about me. I've been in the Medicare field about 12 years. I've had my life insurance license for 14. And I love working with seniors and making sure that they have the proper Medicare insurance plan that works best for them, that meets all of their needs. So I do have a presentation I'm going to show you. If you happen to be watching this live this morning, please put comments in the comment box. If you do watch this later on and bring it up and you have comments, please, you can still contact me with your comments or questions. And at the end of this presentation, I will tell you how you can get a hold of me, okay? So we're going to talk about Medicare. I know all of us are bombarded by marketing, the television, the mail, the emails. Even as I'm doing this presentation, I'm getting emails in regards to Medicare because I'm of Medicare age. So I am part of that targeted population. If you're like me, you have a lot of, you just are being constantly thrown Medicare information is coming to you constantly. And how do you sort through that? Well, that's one of the reasons why you deal with someone like me. I happen to be a broker. I represent not all of the plans, but a good portion of the plans in the area. So first, before I get into Medicare Advantage plans, supplemental plans, and prescription drug plans, let's talk about who qualifies for Medicare. If you're age 65 and older, you will qualify for Medicare, all right? If you are disabled, so if you are under the age of 65 and you have Social Security disability insurance, you qualify for Medicare after 24 months of receiving Social Security benefits. That does not mean if you're getting SSI, you will get it, only if you have SSDI. If you have the illnesses of end-stage renal disease, so if you don't know what end-stage renal disease is, it's most likely you haven't experienced anyone in your life or yourself having it. That's they're having kidney failure and you're on dialysis. If you have what they call ALS, which is also known as the Lou Gehrig disease, you automatically qualify for Medicare. Now, if you're a US citizen and you qualify for Medicare, or if you're a permanent resident in the United States and you lived here for 5 consecutive years, you qualify for Medicare. If you are 65 and you're already collecting Social Security, the likelihood that 3 months before you turn 65, you're going to receive a card in the mail. Now, before the pandemic started, I used to go out and do presentations in restaurants or community rooms. And I met a lady who said, well, I already collect Social Security. I didn't get a Medicare card. So she called me back later on and she said, I had this stack of mail. I never opened it up and my Medicare card was there. So she found her red, white, and blue card with a list. It's not a Social Security number any longer. It's a letters and number combination. So make sure you check your mail and you open it to see if that Medicare card has come to you. If you are not collecting Social Security, you need to sign up, sign up for your Medicare with these 3 options. And that is, you can go online to www.ssa.gov. If you're taking any notes, please write this down. We'll leave this up for a couple of seconds longer, or use that phone or camera and take a picture of it. You can call the Social Security office at 800-772-1213, or they also have a TDY phone number that you call for the hearing impaired. The third option is that you can apply at your Social Security office. So another way you can do that is by making an appointment and going to the Social Security office. So it's real important that you do that. You can do that 3 months after your birthday month and 3 months before your birthday month. And I'm going to go over that again in a little bit. So there are actually 4 parts to Medicare, and there's what we call original Medicare, okay? And original Medicare is what you're applying for when you go to the Social Security, and that's parts A and B. So what are parts A and B? All right. A is your hospitalization. It also is going to include your skilled nursing. It's going to include hospice care and a limited amount of home health care. That is part A. Part B is what they're calling medical insurance, okay? It's your doctor's offices, it's your lab tests, it's your physical therapy, it's your outpatient, it's your x-rays. It's almost everything else, because Medicare doesn't cover everything, but it covers a majority of what our needs are, but not everything. I do not work for Medicare or Social Security. I represent private insurance carriers. So I am contracted with many of the insurance carriers in the area. And if you want to get a Medicare supplemental plan, a prescription drug plan, or a Medicare Advantage plan, you get those through private carriers, and you contact an agent like me, myself. Part A, as I said a few minutes ago, it's the hospitalization insurance. And it's just like it's your inpatient hospital care, it's your skilled nursing facilities, it's hospice care, and it's a limited home health care. Premium costs. If you have worked 10 years, which is 40 quarters, and if you paid into Social Security, you will have no premium. But for some reason you did not pay into Social Security, and you don't have those 40 quarters or less than 40 quarters, you could pay as high as $471. Now, I have one client, she's been my client for a long time, and she, for some reason, did not pay into Social Security. So she pays that $471. It does not go away unless you start paying into those quarters. You can make arrangements to pay into those quarters by contacting Social Security. Now, I'm a person that doesn't have Part A because I worked for a big city government, and I didn't have to from when I signed up. I worked 36 years, and part of my contract with them is that they take care of my Part A. So I don't have those 40 quarters. Now, I've run into a couple of people like me throughout the years. So it's easy for me to identify if you do not have Part A and you're getting that coverage from somewhere else. Now, let's say you've never worked. You don't have those 40 quarters. I have clients that are using their spouse's Social Security information to collect that Medicare. Also, I have clients that are under the age of 65 And some of them, even in their 20s, that have been collecting Medicare throughout their life by using their parents' Social Security number. I hope there's no one out there that's in that situation, okay? All right. Part B insurance, which is, like I said before, your doctor's visit, your preventive services, your outpatient surgery, emergency care, your durable medical equipment. A lot of medical procedures come under Part B. Part B has premium costs that come along with it. Now, if you, majority of my clients fall into this area right here. If they're individual and they're making $88,000 or less, or if they're a couple and they file jointly on their tax returns, they're going to pay $148.50 for each person that's on Medicare. And as you're looking at this chart, it's really interesting. You could see how it starts going up. So I would look at this chart for a second and see where you fall, because it's really good information to have. Part B, which is a late enrollment penalty. People don't realize that you can get a penalty for not having Part B. Now, as I said, I've been doing this for 12 years. And so far, I haven't found anybody that has that does not have the Part B penalty. I have worked with people who sometimes you have Part A, you sign up for Part A, but maybe you're not going to sign up for Part B. But I've had a lot of clients that I've worked with over this last year because of the pandemic that I've helped them, given them advice on how to pick up Part B because they only had Part A. But if you decide not to pick up Part B and you need it, you're going to have a monthly premium that may go up to 10% for each 12-month period that you're not covered, okay? And there are certain conditions that you don't have to pay that penalty. Original Medicare does not cover everything, okay? Original Medicare will pay 80% of your medical bills and expenses, okay? Original Medicare does not cover deductibles. It does not cover co-payments and co-insurance. So what is co-pays and co-insurance? A co-pay is a specific amount of money. So let's say you need to go to the doctor and your doctor's visits, it's stated it's $20 a visit. But if it says that you're going to pay 20% of that, that means if you have a bill that is $10,000, you're going to pay $2,000 out of your pocket. And that's easy to do in the health insurance world. Outpatient prescription drugs. Original Medicare does not pay for it. So that's why you need to pick up that prescription drug plan. Healthcare outside of the United States. I have met several different people who have traveled all the time and they have original Medicare only and did not realize that they had no coverage outside of the United States. I have a client who goes into Newfoundland because that's where her family is from in Canada. And all she had was original Medicare. She got sick, she had a stroke. And because Canada does not recognize Medicare as a credible insurance coverage, they took their own people first before they took her. And when she came back home, she came back with $50,000 worth of bills. That's not a lot for medical for what she had. And she also came back paralyzed on one side of her body. There is a shot, if you get it within the first 4 hours of having a stroke, that they can bring you back to normal. She's still working on her losses, and it's been quite a while. I've had another client who also had a stroke while she was in France, and her Medicare Advantage plan did pay for those bills. So it's important that you realize that there's no coverage outside the United States. Medicare does not pay for hearing aids. It does not pay for the exams. It does not pay for the screenings. And that's the same thing for routine eye exams and most glasses. We're going to talk about supplemental plans. Supplemental plans are for people who want to keep original Medicare. They want to go to any doctor they want to go to that takes original Medicare, and they are going to pay a premium for the supplemental plan. Now, premiums change every year for supplemental plans for two reasons. There can be an increase in the premiums, but they do change on a yearly basis for each birthday as you get older. Now you see there's a bunch of letters here, and it's broken down into two parts. If your birthday is after January 1st, 2020, you're going to look at the plans that are in this area. These plans are usually, these different letters are associated with different regions. The region in my area, we look at G and we look at N a lot. Most of my clients are either looking at G or N. If they had their birthday before January 1st, 2020, they can be looking at C plans or F plans. I have people on F, N, and G plans because those are really good plans and the coverage are really good. I can't tell you what the premiums are because the premiums go by region, they go by age, and things can change. So I signed up a couple and they have an age difference and they're paying different premiums for their plans because they are of different ages. So if you look across here, you see that Medicare Part A I'm going to go over the G, all the way to the F, all the hospital costs will be covered. Under Medicare Part B, we're looking under G and N and F, we see everything's covered. But if you look at K and L, you see that not everything is covered. So that premium will be different. The same thing with the first 3 pints of blood. Hospice care, the same thing here, and what you pay for hospice care, just go across. Another important one is the skilled nursing. You see that I'm focusing on G, N, and F. Everything is paid for. Some of them will pay for the deductible, depending upon which plan. There were excess charges. They are covered under F and G, but you would have to talk with me to go over those excess charges. And they are some coverages, 80% coverage if you travel outside of the United States. Supplemental plans are a really good option for those that want to go to any doctor and not worry about the referral being referred. Supplemental plans do not cover prescription drugs. They do not cover you when you need prescription drug plans, or it does not act as a supplement to any other types of coverage for your prescription drugs. So what are prescription drug plans? So here we go, we're looking at this, and there's There are definitely costs to prescription drug plans. You can get it two ways. You can get a standalone prescription drug plan, or you can get it integrated in your Medicare Advantage plan. So that means if you, and I'm going to go over what Medicare Advantage plans are in a few seconds, but a lot of the Medicare Advantage plans have them already integrated into it. You must be enrolled in Part A and or Part B and live within the planned service area. Now, I just had the situation with Part B where I couldn't get my prescription refilled. It wasn't ready to be refilled before I went to visit relatives. And where I went to visit my relatives at, I had to go to the pharmacy there and they filled my prescription drug because I was traveling. Part D does have a late penalty. And that late penalty, you do not have to pick up a prescription drug plan, but if you don't, there is that penalty. So just 2 days ago, I had a gentleman call me up. He was, he turned 65 in 2009. He has original Medicare. He did not pick up a prescription drug plan. Now, throughout the years I've been doing this, at least once or twice a year, I have been working with someone that has this situation. So I can't even at this point in time provide him with a prescription drug plan. I have to wait to the open enrollment period. And if you look at this right here, you're going to see that there's going to be a monthly premium you'll have to pay, which is 1% of the national base premium, which is $33.06 in 2001. And you multiply that by the number of months you did not have it. So this gentleman is going to have around close to about $20, $25 penalty. So it's real important that you know. And I've picked up people who have Medicare Advantage plans because not all Medicare Advantage plans have prescription embedded in it. And for some reason, whoever sold it to her, whoever provided her with that plan, they did not give her a prescription drug plan. So there's agents out there that don't always give all the correct information. It's just real important that you have that. A lot of people, if you think you're really healthy when you turn 65 and you are on no medication, I don't need to do this. But as we get older, we age. So you want to if you don't pick up a Medicare Advantage plan, then you want to pick up, you get a supplemental plan and you need to pick up a low-cost prescription drug plan, and you can change that as the years go on without getting a penalty. One of the things that's really interesting, every year, as it says, there's 4 annual stages that we have in a prescription drug plan. So if you get a standalone prescription drug plan, you're going to start off in stage 1. So this, when we're talking about the coverage stages, this is the amount of money that you and the insurance carrier spend together. All right. So if you have a standalone prescription drug plan, you're going to have a deductible. And the deductible can be $0 to $445. So depending upon what the carrier is and what the plan is, will determine the deductible range. All right. So once you paid for that deductible, you move over to stage 2. People with Medicare Advantage plans with the prescription drug plan embedded in it start in stage 2, okay? And they have a share of cost. So that share of cost is what you pay and what the insurance company pays. So, and you will get a monthly or quarterly statement, either by mail or signing on to the website for the carrier, that tells you where you're at in this coverage stages. So once you and the carrier spend $4,130, then you would move over to stage 3, which is also known by some people as the donut hole, where you'll pay a cost share of 25% of your generic or your brand name drugs. The maximum out of pocket, which includes the $4,130, reaches $6,550. You then move over to stage 4, which they call the catastrophic coverage, where you see by looking at this chart that this goes down. I work hard with my clients trying to make sure that they can read this. I think it's really important to be reading. A lot of my clients never leave, if they have standalone prescription drug plan, they never spend the deductible. They never get past that. Others, I have go through it depending upon what their medical conditions are and how expensive those prescription drugs are. But this is really important, I feel, for people to know. Now we're going to go to Medicare Advantage plans, which is called a Part C plan. Your insurance carriers will have contracts with Medicare, Social Security, with the federal government to now take over the responsibility of your health. And your Part A and B will go over to the private insurance company that you select, that meets your needs. Medicare Advantage plans are HMO plans. There are a few PPO plans out there, not a lot, depending upon what area you live in is what the availability are, but most of them are HMO plans. They definitely, both HMO and PPO plans have networks of doctors. On the HMO plans, you need to have a primary care physician, okay, who will refer you to a specialist. So it is a referral system. The premiums, according to the area that you live in, and will be low or zero premiums, okay? And they offer what they call value added benefits, which you don't get in Medicare. So you will be able to get that vision, those glasses, those contacts. You'll have dental insurance options to be looking at, and the hearing and the hearing aids. We know how expensive hearing aids are. Over this last year, dental has become a real popular part of these particular Medicare Advantage plans. So we're going to go over enrollment periods right now. So an enrollment period would be a 7-month window, which they call the initial enrollment period, where you can sign up. You have 3 months before your birthday month, and you have 3 months after your birthday month. So if you are turning 65 in July, you have April, May, and June, and then you have the 3 months after your birthday month, August, September, and October, to sign up for Medicare and and Medicare Advantage plans. The annual enrollment period is for people who want to sign up for a Medicare Advantage plan or prescription drug plan at that time, and they haven't done it before in the past, or they can sign up for a supplemental plan and look at that. Supplemental plans have different rules than Medicare Advantage plans. Then they have the open enrollment period plan that we're in right now, which is January 1st to March 31st. That's for people who have Medicare Advantage plans. They are allowed to change the plan one time, go back to original Medicare, and that would open up a special election period for picking up prescription drug plan. I just had someone the other day who I picked up as a client who changed her plan and called me up, and she said, Janice, my prescription drugs are too expensive under the new plan. We did research them, but she got a new prescription drug plan. I want to go back to my old plan. So we compared the plans together, and I'm going to be having her move back to the plan that she did have. So you can do that one time. There is a lock-in period where you can't change your plans. And we're talking Medicare Advantage plans only, and prescription drug plans from April 1st to December 31st. But the open enrollment period is for Medicare Advantage plans or going back to original Medicare. There are special enrollment periods. I have some clients right now that are moving out of this state and moving into another state. I'm working with the agent in the other state to help them out, and we're working to make sure that they have a smooth transition. So you have the month before you move, and you have 2 months after you move if you do that. If you lose your, for some reason you go and you get ready to retire, and you need to now go on to full Medicare, you will open up a special election period. Medicare supplemental plans have a different enrollment period. It's a 6-month window that begins on your Part B effective date or your 65th birthday, whichever is the latter, okay? There's no medical underwriting. You can choose from many of the Medicare plans options. Remember, I showed you the GFNC plans a few minutes ago. You can choose from that. Now, Medicare supplemental plans have something that's called a guaranteed issue situation. There are several other guaranteed issue situations to enroll into Medicare supplemental plans with no underwriting. So originally it would be when you turn 65, okay, when you lost your coverage or you moved to another area. All plan options may not be available in all the different areas. And if you do not qualify for guarantee issue, you will go into underwriting. Now, I have a client that called me up recently, and she has a Medicare Advantage plan. Over the last year, she's had some medical issues that have come up, and now she wants to go to the supplemental plan. I know by the medical issues that she has, she will not qualify for a supplemental plan. So we're going to look at her birthday month and see if we can get her qualified then. Star ratings. All the different plans have star ratings. The carriers have star ratings. So when you get that survey in the mail saying, how did your doctor's visit go? How did your insurance, when you called the insurance company, how well did that person, representative, help you out? Okay, I've got a head here, the star ratings. So it's a member satisfaction. They want to see how satisfied you are. The star ratings go from 0 to 5. I like working with plans that are 4 and above. If I have someone that requests a carrier that, or a plan that's less than 4, I will work with them, but I will tell them about the star ratings. I always tell people about the star ratings. It's really good information to see. They have 50 key factors that they use to rate all these different carriers. If you want additional information, please contact Medicare.gov. Now we have COVID-19 coverage, and I'm going to go over this just really quickly. Of course, this is new, but if you have Medicare Advantage plan, there is some health options out there for you. Okay. If you're continuing with your employer, you're going to get some help. If you continue, wait a second, I missed something here. Hold on, let me go back. So at a glance for the COVID-19, the lab tests, you pay no out-of-pocket costs under Medicare or the Advantage plans or the supplemental plans. The FDA authorized COVID-19 antibody tests have some coverage to them. All medically necessary hospitalizations for quarantine purposes and any hospital deductibles, co-pays, and co-insurances will apply. The vaccine, which is now available to us, is covered under Medicare. Medicare prescription drug plans, which is in short MAPD plans, may offer additional coverages like telehealth benefits and expanded benefits like meal delivery, medical transportation. I know the telehealth has been around for some of the carriers going on 3 years now, but since the pandemic, that has increased. Other additional benefits, some of the carriers will provide you if you come home from the hospital and you're really sick or you meet certain criteria, some meal deliveries. Or a lot of my clients like the transportation services. They think that's really good. Now, my services, which my presentation jumped to really quickly, I'm here to help you. If you're still working, I can advise you that you should at least sign up for Medicare Part A, because it will act as a secondary insurance to your employers. Or if you're still working and your employer does not want you, is not going to provide you coverage, we can provide you, I can help you out with that. If you've continued to work and now you've retired, or you're in the military, or you have the veterans, I can help you with that also, picking up on what you're supposed to do and how to qualify for Medicare and get those Medicare Part C, Medicare Advantage plans. Remember, Medicare Advantage plans can have Part D in it, coverages, and any other additional benefits. If you roll in a Medicare supplemental plan and a standalone Part B prescription drug plans, I love to be able to help you. Now, what I like to do when I work with my clients, I have this up here, but I always like to sit and listen to you. and hear what you have to say. And from what listening to you and what your needs are. Not everybody's needs are the same. We all don't go to the same doctors. We all don't live in the same areas. We all have different specialists. We all take either no medication or a lot of education, or maybe you're looking for additional benefits. I look into all of those different things for you to make sure you have what best suits all of your needs. And I'm right there along with you. I make sure that after you have the plan, that I'm available to discuss anything that you may need afterwards or to answer any of your questions. It's just really, really important. So if you would like to contact me at a no cost consultation, I love to talk with you. You can sign on here. I do these shows on a weekly basis, but Medicare is our topic for today. We're going to have another show coming out this week, I hope soon, about finances. I have had lawyers. Next week I have a chiropractor coming on. We have different subjects that we talk about, but for today we did this Medicare right here. So if you're interested in finding out about other programs that we offer, please contact me. For Medicare insurance, please look at my website. It's focused for Medicare insurances only. And as I said, we do free consultations. During this pandemic, we're doing a lot of Zoom consultations, a lot of over the phone consultations, and we do our best to work with you and what is going on. So everybody have a wonderful day. I hope to hear from you. If you are seeing this on Instagram, Facebook, LinkedIn, and you have any comments, please put them in those areas and I will get back to you within a day or two with the answer to any questions that you have or comments. Thank you very much. And I will hope to see you next week. Bye.